Hi, this is Craig Merriweather of Arizona Integrative Hypnotherapy. When the body and mind are overwhelmed with stress, fear, worry, and anxiety, it may feel like your mind is constantly whirling, or the tiniest mishap sets you off into fear and worry, or you're dealing with physical responses like increased heart rate, muscle tension, headaches, irritability, and insomnia. And you might even know on a rational level that you're blowing things out of proportion, but on an emotional level, the experience of panic and dread can still be overwhelming. Now, the subconscious mind works through automation, beating your heart, breathing, running your immune system, walking, riding a bike, navigating a spoon to your mouth, and driving a car are all examples of automatic habits. Things you don't have to consciously think about doing. They're habits because you practice them over and over again with the conscious mind until they became a natural part of your physiology. Now, thoughts and emotions can also become automatic habits when practiced over and over again, just like learning to walk or driving a car. If fear and stress are what you are practicing over and over again, then fear and stress are becoming an automatic subconscious habit. Practice doesn't make perfect, it makes permanent. And what you make permanent becomes your subconscious programming. Now, can hypnotherapy help deal with stress, fear, worry, and anxiety? Yes, hypnotherapy is an excellent method for calming down inappropriate anxiety because the natural process of hypnosis is just deep relaxation. And from that state of natural deep relaxation, you can retrain your brain and body, reprogram your mind to feel calmer in the situations that would have once caused you to worry and feel anxiety. So I want to show you what the published research says about the effectiveness of using hypnotherapy to deal with stress, fear, and anxiety.
What does the research say about anxiety and hypnotherapy? Well, this is from Harvard Medical School's mental health newsletter. And it says, hypnosis also helps to alleviate anxiety. It has been studied most as a treatment for anxiety related to surgery. Many studies have reported that hypnosis reduced anxiety levels and lowered blood pressure in patients before surgery and enhanced recovery afterwards by shortening hospital stays and reducing complications like nausea and vomiting. The newsletter talks about a 2006 study where patients underwent hypnosis, receiving suggestions of well-being before surgery. Upon entering the operating room, they reported anxiety levels 56% lower than anxiety levels before hypnosis. And patients in a comparison group who received the normal pre-surgical standard care reported 47% increase in anxiety before surgery. Now, this is from an article in Monitor on Psychology. It's a monthly publication from the American Psychological Association, which you can find on their website. And it reads in part, a growing body of scientific research supports hypnosis's benefits in treating a wide range of conditions, including pain, depression, anxiety, and phobias. And from the same American Psychological Association article is this quote from Dr. Michael Yapko, a psychologist. And he says, hypnosis works, and the empirical support is unequivocal in that regard. It really does help people. Now, this is a research study titled Hypnosis in the Treatment of Anxiety and published on the National Institutes of Health website. The abstract reads, hypnotherapy and training in self-hypnosis can help persons achieve remarkable success in alleviating anxiety, not only anxiety disorders, but also in any problem involving anxiety. The author describes the role of hypnosis in the treatment of several disorders and provides clinical examples illustrating treatment of generalized anxiety, phobias, and post-traumatic stress disorders. He concludes that because hypnosis exploits the intimate connection between mind and body, it provides relief through improved self-regulation and also beneficially affects cognition and the experience of self-mastery. And also one more research study that was also published on the National Institutes of Health website titled Hypnosis in the Treatment of Anxiety and Stress-Related Disorders. The abstract reads, self-hypnosis training represents a rapid, cost-effective, non-addictive, and safe alternative to medication for the treatment of anxiety-related conditions. Here we provide a review of the experimental literature on the use of self-hypnosis in the treatment of anxiety and stress-related disorders, including anxiety associated with cancer, surgery, burns, and medical and dental procedures. An overview of research is also provided with regard to self-hypnotic treatment of anxiety-related disorders such as tension headaches, migraines, and irritable bowel syndrome. The tremendous volume of research provides compelling evidence that hypnosis is an efficacious treatment for state anxiety, so anxiety prior to tests, surgery, and medical procedures, and anxiety-related disorders such as headaches and irritable bowel syndrome. All these research citations can be found on the Arizona Integrative Hypnotherapy webpage about anxiety, which you can find at aziht.com/anxiety. There are 4 anxiety-related problems that hypnotherapy is commonly used to address. Physical tension and strain. Physical pain and tension, which often has its roots in emotional tension, can be addressed by hypnotherapy. Addressing and working to alter the beliefs that you have about the triggers for your anxiety can help reduce the frequency and intensity of the physical straining symptoms of anxiety, such as rapid heart rate, rapid breathing, and shaking. In addition, it can ease feelings of discomfort and strain by implanting the suggestion that you feel more physically comfortable than you actually do. Emotional strain and moodiness. Along with physical strain, constant or frequent anxiety can also put you in a strained emotional state. The energy from your body that is required by physical symptoms of anxiety, along with the persistent feelings of discontentment, frustration, and worry, can make you feel drained or on edge. The foundation of hypnotherapy is natural, deep relaxation. And hypnotherapy can help put people in a more positive frame of mind, altering unnecessary negative beliefs and implanting more helpful ones. Sleeping problems. Many people with anxiety also have difficulty sleeping well. Chronic stress keeps you in the fight or flight response, and your body and mind may actually believe it is unsafe and a threat to survival to be relaxed, restful, and asleep. Getting to sleep in an anxious state and sleeping deeply when nightmares and muscle tension are keeping you awake can be nearly impossible. Hypnotherapy assists with sleep deprivation by moving the nervous system out of the stress response, the sympathetic nervous system, and into the relaxation response, the parasympathetic nervous system. We might also use the technique of implanting suggestions that you have gotten plenty of restful sleep recently. And hypnotherapy can also help you alter your anxious thought patterns so that they don't spiral out of control and keep you awake, as well as causing the panic attacks that can result in muscle tension. Fears and phobic reactions. Going to a hypnotherapist for help in conquering a phobia or fear, for example, fear of public speaking or fear of flying, can be far preferable to taking medication in order to remain calm during everyday activities. You can use hypnotherapy to replace your unhealthy or illogical beliefs about the object of your phobia or fear with more logically sound and useful beliefs. Now, I've created 2 other videos about using hypnotherapy to deal with fears and anxiety, which you can find by going to aziht.com/anxiety. There's one video that goes even deeper into explaining how hypnotherapy illuminates possible patterns of beliefs in your subconscious mind that may be blocking you from health, joy, success, and abundance in your life today. And then this video explains how hypnotherapy can help reprogram your brain by adding positive healing suggestions to your subconscious mind for success, health, and reaching your full potential. And the second video is an actual hypnotherapy session, so you can experience what that is like, and also what an online session over Zoom would be like. You can find both videos by going to aziht.com/anxiety. I want to end with my favorite quote regarding hypnotherapy. It's from Dr. Deirdre Barrett, a psychologist and faculty member at Harvard Medical School. She says, "I found that many complaints, smoking, overeating, test anxiety, public speaking phobia, and chronic physical pain responded more dramatically to hypnosis than any other form of psychotherapy I was using." Whether you are trying to overcome an old problem, habit, or behavior, or simply want to grow to a new level of personal achievement or increase your health and well-being, hypnotherapy can very possibly help when all else has failed. If you have any questions regarding hypnotherapy, please send me an email or give me a call and I'd be happy to talk with you. Thank you for watching.